My name's Naomi Hansen. I'm the Veterinary Director at the North Coast Emergency and Critical Care Centre at Sippy Downs on the Sunshine Coast. This afternoon we're going to talk about gastric foreign bodies. So what that means is something that's foreign in your dog's stomach. And you may be surprised how often we see dogs that have ingested foreign material. And by foreign material, I mean anything that actually shouldn't be in the stomach. So anything from grapes to bits of plastic to little toys to dummies to socks to anything that you can imagine. I feel that at some point in my career, I've seen a dog vomit it up. Dogs have a habit of just putting things in their mouths and they just don't think about it. And I feel like owners have a habit of watching their dogs quite closely and then noticing when this has happened. We do see some sharp objects that have been consumed as well, and they do cause us more of a concern. So what do we do about dogs that have eaten foreign material? I think the first point of call is if you've seen your dog do it and you're near to a vet clinic, my first point of advice is to take your dog into the vet clinic as soon as you possibly can, because like some material is quite easy to remove from the stomach if we can make your dog vomit. So anything that's sharp or anything that's likely to be irritant, like a chemical wise, anything like that, we tend not to make the dogs vomit, but anything that's, let me think, like soft, so soft toys, socks, underwear, dummies, anything like that, it's quite safe to make your dog vomit. So if your dog's ingested a foreign material like that, take him down to your local vet clinic. More often than not, they'll give them either an injection or a tablet that will encourage them to vomit. And fingers crossed, whatever they've ingested comes out straight away. And that's literally the best case scenario. Okay, another scenario is that your dog's maybe ingested something that's a little bit more abrasive. We see this with dogs that have ingested fish hooks, sometimes needles, sometimes tacks or earrings. Because as you can imagine, if we were to make your dog vomit after eating something like that, there's a chance that it may actually irritate the esophagus on the way back up. So for those kinds of things, we tend not to recommend making your dog vomit because we know that it may damage the esophagus. So then what are our options? I think fortunately most of those things, if you think about it, are radiopaque. So that means that they're quite firm, their density is similar to or denser than bone, so they will show up quite well on a radiograph. So the first thing to do is take an x-ray and maybe confirm that your pet's actually eaten it. Because quite easily on x-ray we can see things that are metallic, we can see things like stones that are quite dense, we can see bits of bone and things like that. Once we've confirmed that there's something in the stomach, then I feel like your options are to induce vomiting. It's not something we could recommend, but it is still an option. Another option would be to use an endoscope to actually remove the sharp material from the stomach. So an endoscope is like a light and fibre optic cable source. Usually what we would do is anaesthetize the patient, and then the scope would go down the esophagus into the stomach. And then we have little grabbers that grab the foreign material out, and then we just pull it back out through the esophagus. And sometimes it does take a little while to find little things in the stomach, but that's quite an efficient way of removing sharp objects. Now, the only downside to that is if you think your dog's eaten a sharp object and you think that it may have to be removed, please don't feed your dog, because if you can imagine going into the stomach with a little scope, trying to find a little like needle or a little tack, if there's a lot of food there, it's really, really difficult. So if you think that your dog's eaten something sharp and you might need to have it removed, do not feed your dog. Okay, so what if we don't get the foreign material out of the stomach? So I think the next thing is, if we can't remove it with a scope, then the next step is to go from there into theatre and look at removing any foreign material via surgery. So what that involves is an incision into the abdomen and exteriorising the stomach and then removing the material that way. So I feel that it's something that if you see your dog ingest something that they shouldn't have eaten, my advice to you is don't wait, because if you wait and it goes past the stomach, it's a lot more difficult to retrieve. So go call your vet, make an appointment. They may need to take x-rays, or they may just say, look, we'll make fluffy vomit and see if something comes up. If you wait, there's a chance it goes further and then it becomes more of a surgical procedure than a scope or just making your pet vomit. Okay, so if you see your dog in just something that shouldn't, go to your vet. They may or may not take x-rays. They may or may not elect to make your dog vomit. Be aware that if it's something sharp, that you may need to have it removed with an endoscope, which is a safer procedure, or if it is lodged in the stomach wall, you may need to have a surgical procedure undertaken to remove it, and that does happen with some fish hooks. But I think the most important thing is to not wait, because even if it is soft material and you do think, you know, maybe it will be okay, and it goes into the small intestine and it causes a blockage there, we have no real option but to remove it surgically. So I feel like quite often we try and avoid surgery and look for one of the more conservative ways of treating it. But if you think your dog's eaten something it shouldn't, just check in with your vet and they'll be able to advise on what the next plan of attack is, because it happens more commonly than you would think.